Ethical dilemmas occur every day in healthcare. Hi, I'm Christy Wyatt from Rosie, Arkansas, and I hope this video will help you to determine the difference between ethical and unethical behaviors in your everyday healthcare workplace. Raymond Edge defines ethics as the critical reflections about morality and the rational analysis of it. In other words, it's a generic term for the study of how we make judgments regarding right and wrong. We will explore several areas of possible ethical dilemmas, including confidentiality, role fidelity, sexual misconduct in healthcare, allocation of scarce resources, patient autonomy, and dealing with AIDS in healthcare. Confidentiality is a topic that's been at the forefront of healthcare since the enactment of the Health Insurance Portability and Accountability Act. HIPAA provides the primary guidelines for maintaining confidentiality in the healthcare workplace today. Bill, a friend of the lab tech, had been to the lab for some routine testing. The tech was later approached by a mutual friend who had seen Bill at the lab and was inquiring as to the purpose of Bill's visit. Disclosure of any information to Bill's friend, even a confirmation of Bill's visit, is a breach of confidentiality and is considered unethical behavior. The proper and ethical response to an inquiry such as this would be for the lab tech to inform Bill's friend that he cannot disclose any information to him about any patients of theirs. Healthcare providers frequently find themselves in situations where they're tempted to step outside their scope of practice. Sherry is an experienced and very knowledgeable phlebotomist who's developed a close relationship with some of her recurring patients. These patients sometimes ask questions to Sherry regarding test results and what the results may mean. It's not within the scope of practice of phlebotomists to interpret lab results. Therefore, for Sherry to provide diagnostic information or interpretation of these results to these patients would be considered unethical behavior. The ethical response to questions such as these would be for her to tell the patient to discuss the results with their physician. According to Raymond Edge, it is generally held among all healthcare providers that sexual relations between practitioners and patients are unethical. In situations of scarce resources, it's my opinion that the utilitarian theory of justice is the most ethical method of allocation of these resources. This theory holds that the resources are divided in a way to provide the most good to the greatest number of people. An informed consent is required prior to a blood transfusion in order to inform the patient of the risks involved and symptoms to look for during the transfusion. The consent ensures patient autonomy by giving the patient the right and power to choose whether or not to receive the transfusion. Confidentiality in healthcare applies to all patients, even those who are HIV positive or have AIDS. Some may argue that all healthcare providers need to know the disease status of their patients for their own protection. However, Raymond Edge implies that the need to know of a patient's diagnosis has more to do with appropriate patient care than with employee protection. For example, it's not necessary for a phlebotomist to know the disease state of their patients because they should be practicing universal precautions where they treat all patients as though they are infectious. As you can see, healthcare providers are faced with ethical dilemmas on a daily basis. I hope this video will help you to build a foundation on which to make decisions in the ethical dilemmas that you're faced with in your workplace.